Hello everyone, welcome back to this channel. Today I have an interesting video which is about the importance of dehydration in terminal phase of an illness. We need to understand that at the terminal phase of a disease process, patient being dehydrated might be beneficial to him or her, because at the end of it all, the goal of the care that is being provided at this stage is to ensure maximum comfort. So sometimes this patient experiences symptoms, different varying symptoms depending on specific condition they are suffering from, be it cancerous or non-cancerous. But at the end of it all, some of these symptoms might be preventable when those patients get into dehydration. So I'll start by the first significance of this dehydration, which is reducing. It plays a role in reduction of gastrointestinal tract secretions. And remember, these gastrointestinal tract secretions play a role in vomiting in these patients. And vomiting may have detrimental effects on the patient, because at one point the patient might aspirate the vomiters, leading to alteration in his or her respiratory system, and thereby leading to respiratory failure and and fatality. So a dehydrated patient will have less amount of water or less amount of secretions. Therefore, even the healthcare provider or the person caring for this patient will not have a difficult time sanctioning the patient every now and then. Remember, some of these patients who exhibit these signs, this gastrointestinal sign of vomiting when in terminal illness, because the patient consciousness might be alterated. You will need to be vigilant in ensuring that there is a sanction machine available just in case the patient aspirate. You will be able to intervene promptly. So the next reason, the next importance of dehydration in a terminal patient is that it helps in reduction of respiratory tract secretions. Remember, these respiratory tract secretions, they play a role in blocking the airway, making the patient have reduced oxygen in his or her tissues, which might even affect the functioning of the body parts. The other thing is that accumulated secretions in the lungs or even in the air sacs or the alveoli will lead to impaired gaseous exchange in this patient, and therefore they will lead to retention of carbon dioxide. And remember, once the patient has a lot of carbon dioxide in the body due to reduced respiratory or altered respiratory function, that patient will perhaps develop respiratory acidosis, and this will be of negative effect to the patient, because unless urgent interventions are done to reverse that acidosis, it might leave him or her condition compromised. So the other reason why dehydration is important is that it reduces the instances of ascites and edema. Ascites is generally accumulation of fluid in the peritoneal cavity of the abdomen, and edema is having excess fluids in the body that might accumulate in tissues in the periphery, face, or anywhere in the body. So a patient who is dehydrated will not have such signs of edema, which edema basically alters the patient outlook. For example, if a patient has edema of the legs, his perception of self-image will be altered, because that patient perhaps previously did not have edematous legs. So that will affect even the patient psychologically. Again, ascites has very detrimental effects to the patient, because it can lead to even impaired breathing as more fluids accumulate in the abdomen. Remember, some of the work of the breathing is carried out by the diaphragm, whose movement varies according to what activity of breathing is happening at a particular time. So with accumulated fluid in the abdomen, the diaphragm will not be able to move freely. Thereby, the chest expansion will be altered. The other thing is that a patient with ascites will have a bloated or a swollen abdomen, and this fluid might even compress the stomach, reducing the capacity of the stomach, thereby even altering the feeding habit of this patient. So a patient who is dehydrated will not have such. The last importance is that it leads to dehydration will lead to reduced level of consciousness. And remember, I said that whatever intervention we are carrying out at the terminal phase is predetermined by what goal we have, end of care goal we have for that patient. So if we see that this patient is suffering so much by having a correct GCS, or being fully conscious, at a particular point, dehydration might be of significance, as it will help reduce the level of consciousness of that patient and thereby reduce suffering. Remember, end of care goals in a patient are aimed at ensuring maximum comfort for that particular patient. So depending on the prevailing circumstance and what we are aiming at while managing a particular patient, dehydration might be of consideration, because it will help in improving the quality of life of the patient, and also ensuring that the patient has less suffering as he comes to the end of life. Thank you for watching this video. Please remember to like, share, subscribe to this channel as we load onto more video and more activity. Thank you so much.